Good morning. My name is Michaela Washington. I'll be discussing maternal mortality rates in Black women. What is maternal death? Maternal death is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective to the duration and the site of the pregnancy for any causes related to or aggravated by pregnancy or its management, but not limited to accidental or incidental causes. Some of the complications that Black women face during pregnancy is major bleeding, severe bleeding, high blood pressure during pregnancy or after pregnancy, heart attacks and strokes, and infections. Infection as far as the location on the body, whether it's in the vagina cavity or the incision site if she had a C-section. Also, the initial location of the contraction of the infection, whether it was in a medical facility or post-home care after leaving the hospital. Some of the challenges that Black women face when it comes down to care is they're uninsured. They don't have the insurance, they don't have the health coverage to provide the services that they need, such as going to see the OGBYN, overall comprehensive medical checks. So reducing the health costs while maintaining high quality care is what we need for Black women who are childbearing. They should be able to receive the same type of quality whether they have insurance or not. Also, more importantly, improving the access and the coverage for Black women. If they have the access and it's feasible in cost, they will be more likely to go and attend their appointments on a regular basis. Also, encouraging healthy behaviors such as eating adequate foods, receiving good sleep and sleep hygiene, and good behaviors and exercise and things of that nature. Establishing therapeutic rapport with clients. So this is more of the perspective with the physician. If the physician does not how to approach them culturally, then they may have issues or maybe less likely to attend their appointments because they don't know how to address their clients based off their cultural biases. And also there's sex biases and race is a big determinant of experiencing racism from white medical professionals and things of that nature. So statistics shows that in 2021, the mortality rate for Black women was 69.9 deaths per year on live births, and that's two times higher than white women at 26.6 deaths. So Black women are 3 to 4 times more likely to die due to complications during pregnancy or after pregnancy than white women. And many of these deaths can be preventable. They can be stopped before the signs and symptoms even arise in the hospital. But as long as they do proper monitoring of their vital signs and check check to see if things are having any adverse effects as far as the medication, they can keep the patient from having adverse effects once they leave the hospital or causing death. As far as research, there's a lot of research on uterine fibroids, cervical cancer, and ovarian cancer. And these cancers are more prone, especially uterine fibroids in white women. So researchers are not collecting and tracking and analyzing data for Black maternal deaths. They're not allocating funds to understand why Black women are having so many complications when it comes down to pregnancy, because the focus is more on the white race, on the white female race. So how do we address this from a theoretical standpoint? So during pregnancy, we want to improve the access and deliver the quality of care for Black women. And we want to include in managing the conditions and educate them on the things that they are prone to during pregnancy and after pregnancy. So at delivery, we know that a lot of Black women may or may not have access to health care. But if they don't have access to health care and then the areas that they live in don't have standardized patient care, that affects them as well. So that increases their risk of complications during pregnancy and after pregnancy. As far as postpartum, we want to provide high quality care for the mothers, for Black women once they leave the hospital, and communicate and advocate to them and educate them to understand the importance of receiving care once they leave the hospital and make them feel comfortable enough to go to any medical facility. Cultural competence. So cultural competence is the ability to work effectively with people from a variety of cultural backgrounds. This includes respecting their values, respecting their beliefs, acknowledging their traditions, and that these three aspects affects and impacts the behavior and the interactions within a society. So if you have a white physician that does not understand the boundaries of a black culture for a black woman, he may offer things that she may not be in favor of. But versus if she have a black physician and is more cultural aware of the things that black women faces when it comes down to maternity rates, mortality rates, they will be more feasible to go and um, seek care. What is the ethical practice? So, ethical practice, you always want to respect the dignity and worth of each person, each client. We have commitment to our clients and we want to promote the well-being of our clients. And we want our clients to understand that they are our primary focus. We're going to have to understand we have to put our biases and our beliefs and our values to the side and focus on them as a perspective. Um, Also, we are assisting clients and female in the more specifically black women that what are their goals and their goals of having a safe and effective or safe pregnancy, a safe delivery. And as far as informed consent, ensuring the client has a clear understanding of the purposes of the services, their related risks, and the cost of services. If they don't have insurance, then it's important that we find resources that'll help them, that would take them and provide care and give them quality care while they're in these medical facilities. Ethical practice continued. So we also we want our clients to understand that their privacy and their confidentiality is secure. Anything that they share with us is safe and it stays in the guidelines within our conversations unless they intend to harm themselves or someone else. That if they intend on harming someone else, we do have the right to warn that person. We also do not share any information with anyone who is not associated with that client or with that client on a professional basis. And we want to provide service utilizing our skills, displaying values, and our knowledge to help those the best way that we can, providing them with resources and services, and practicing social justice and promoting social change within the black woman community, so they have access to information and services that are available to them, their community, at reasonable prices. So as social workers, the women that are overcoming the black mortality rate, female maternal mortality rate, we can always provide resources such as housing. Once they leave the hospital, they have to have somewhere to stay and house their child. Food, formula, WIC, welfare dependency, and those things that are nature that they need to sustain the lives of their child and themselves. And more in transportation. If they don't have the transportation to get these things, that we should find ways as far as public transportation or bus fares and things of that nature, so they can to get the grocery stores and other facilities to provide food, especially if the client lives in a food desert. And after birth, some mothers may experience postpartum depression. We want to provide them with mental health services and comprehensive care for follow-ups and checkups and things that nature to ensure that they're not having adverse effects once they leave the hospital, and for them to recognize the things that's going on with them, with their bodies and their children, to prevent death. So this is the last slide. These are my resources that I use to pull the information that I use here in this slideshow. Thank you.